Hey everybody, I wanted to just take this quick moment to explain a little bit more about decompression and why I'm adding it to my practice. The best way to show you is to actually show you on a model. So I'm going to do a screen share here and help you see exactly what we're talking about. So when we're talking about this decompression, what we're doing is in this example, we're going to do the lower back. And so when we hit play, you're going to see these green arrows pushing, and actually it's going to be pulling the spine in two opposite directions. There's some really comfortable wraps that you put around your waist and around your rib cage to really distract you, really pull apart those vertebrae. 90% of the people don't even realize that, 90% of Americans have some kind of disc injury, whether it's a bulging disc, herniated disc, slip disc, or like degeneration, like arthritis in their spine. And all those things are what put pressure on the nerve. And I want to show you what that looks like now. So as we zoom in on this, you're going to see that this red part is where that disc is herniated. So that disc is injured. So the disc is narrow. The one to the side here on the either side is fluffier. It's almost like a marshmallow, nice and fluffy, and there's no pressure on that nerve. The yellow is the nerve. In the injured disc, it's almost like a pancake that's been flattened. Or the best analogy I use for people, everybody knows what a jelly donut is. So if you wrapped a jelly donut up in saran wrap and you press down on it, that gooey jelly in the middle is going to squirt out to the edges of that saran wrap. That's what's putting pressure on this disc here. And so when we add this decompression, what we're doing is as you're pulling it apart, and so you can see how these vertebrae are being pulled apart, the pressure is coming off of the nerve and the nutrients are being sucked into that disc. That disc is mostly cartilage and collagen fibers, and that is a lot of water. And so in decompression, what happens is we go decompress and we let it go, and we decompress and we let it go. And what happens is, you can see here, it's going to separate again. This back and forth that happens helps those collagen fibers rub against each other and get sticky again. And that stickiness, which is really water, is what's going to help that disc heal and help get the pressure off the nerve. I cannot wait till the end of February.